I am Dr. John Catanzaro, and I'm president and founder of Health and Wellness Institute of Integrative Medicine, and I've been in practice since 1996. And I started this practice because of a passion for people, and I had a really strong passion to work with people one-on-one. And the whole practice was started based on that foundation. I always had an interest in medicine since when I was a little kid. I was probably about 9 years old when I had the dream of being a doctor. There were three things that I wanted to do in life. I wanted to be a baseball player. I wanted to go into space and go to the moon, and I wanted to be a doctor. The reality is that the doctor part was the strongest part that kept with me all these years. When I first got into practice, it's pretty amazing in how people come to your door, and your practice actually becomes filled with people that have different problems. My first cancer patient came through the door at the clinic, brought in by her husband. She was totally weak and malnourished, and she was barely able to talk, and her husband had to do most of the talking for her. But her husband basically brought her in and said, "Is there anything that you can do for my wife to save her?" And I was hit right there that I was going to need to think about more comprehensive ways of helping her with this cancer. She was very aggressive, stage 4, very advanced. And so with that, I did a lot of research, and I pulled all of the therapies that I could really work with, and developed a treatment plan for her that was very comprehensive, including intravenous nutritional support, immune therapy, and dietary changes, and a lot of close one-on-one with the patient. And within 3 months, this patient was able to stand on her own 2 feet. Cancer treatment has been my specialty in practice for going on 17 years. And I have treated many patients with integrative, alternative, naturopathic medicine. And through the years, I've had many success stories with these patients. Back in February of 2012, one of my patients who had a very aggressive stage 4 breast cancer, and she was also not doing very well. Her prognosis was she was going to probably live maybe 6 months to a year. And I worked with this patient very aggressively to try to get her better. Within 10 days of after starting her peptide approaches and her immune therapy and doing her IV therapy, she started immediately noticing more energy, getting better. Her tumor, within 10 days after starting her immunotherapy, began sloughing off in major pieces. There was a tumor the size of a grapefruit. Surgeon wrote her off. She was bleeding. She was needing transfusion every 3 days, and basically there was no hope for her. Within several weeks, she started getting better. Her tumor started breaking down. She started getting more energy, and then within, I would say, probably a month to 6 weeks, she noticed that her tumor was drastically reduced to almost being noticeably gone. She went back to the oncologist that she had initially went to that gave her a no-go. And the oncologist, because she saw such results with the therapy, she decided that this was a type of treatment that was not within the scope of my practice. She reported me to the Department of Health. And she never contacted me, never said a word to me, never corresponded with me. And I'm the type of physician that when I work with my patients, I work with these patients and coordinate the treatment plan so that we also include oncology care and team care, because I believe in the blended approach. I want to see patients have the best approach possible so that they can beat their disease, beat the diagnosis of cancer. Well, the oncologist said that she believed that I was doing an unfounded treatment, that I was not properly informing my patients, not having them sign informed consents, not having them really educated about the treatment, and that was unethical and that needed to be reported to the Department of Health, which all of these allegations are unfounded and not true. The Department of Health actually served me papers on January 27th of 2014, and they took my license, and I can no longer practice medicine. Since my license suspension, I haven't been practicing medicine, and the Department of Health has since scheduled a hearing date in August, and they haven't set a firm hearing date in August. And from January to present, I've had a lot of changes in my life. Not able to see patients, not able to treat patients, and the overwhelming costs of this to my business, to my practice, most of all to my patients not being able to receive treatment, is very heartbreaking to me. And it's heartbreaking to my patients and my friends who have known me in the community for 17 years. I've had a very good reputation in the community with my patients and with my colleagues. And my patients and colleagues know that I have administered the best medicine to my patients, and I've never had any patient complaints at all. And so with this, it's cost me a lot. It's been costing me a horrendous amount of legal fees because I had to hire legal defense, and legal defense is very costly. And I don't know what business directions, what's going to happen with that. I'm not for certain. I know that I can't practice, and that affects my ability to earn a living. This is 17 years worth of work for me. And I have worked very hard in building a practice that's built on integrity and helping people. And I can't fight this alone. I need your help. Help with legal costs, help with writing your state representatives, writing letters, showing up at the hearing when the hearing comes, financial help. I can't stress enough that the financial strain that this has put me under is very, very deep. And I'm asking for your help in this so that I would be able to continue treating my patients.